Hello everyone, I'm Li Wei from Hong Kong Center for Cerebral Cardiovascular Healthcare Engineering. Today I'm going to talk about disease detection tool using labor-free liquid biopsy-based platforms for patient-centric healthcare. So firstly, I will briefly introduce the background of my research. So according to the recent report that the annual number of new cancer cases in Hong Kong growing rapidly, and also it is widely acknowledged that the cancer is very difficult to irradiate because of the tumor heterogeneity, which also limits the rational drug use to treat the cancer. Besides, during the treatment process, several complications would occur, which making cancer more difficult to cure. The effective treatment strategy cannot be identified for early intervention. The conventional cancer detection method is based on the solid tumor biopsy. Doctors need to cut pieces of patient tumor to do the pathological study with some staining method. The drawbacks of this method is very convenient. The whole process is very time consuming, and the method is invasive to the patient, would cause much pain. Currently, there is an emerging method called liquid biopsy, which is a method to detect of the circulating biomarkers within the patient biofluid. Com Compared with conventional stand tumor biopsy, liquid biopsy is much more quicker, and the sample is more easier to obtain, would cause less pain to the patient. Several common circulating biomarkers are circulating tumor cells, circulating tumor DNA, and extracellular vessels, which can comprehensively reflect the tumor profile. Here we focus on detect the circulating tumor cells. We've uniquely developed a microfluidic biochip, which mainly contains three layers, which are the first drug gradient generator layer, which can generate a different concentration of the drugs for drug screening tests, and the second reservoir layers, which can and retain the cell culture media, and the third customized microwell array layer, which can establish the patient-derived cell culture models. After the cells has been seeded within the our biochip, which could establish the patient-derived cell cultures within 14 days. As we can see from those two representative images, that the cell cultures derived from healthy and patient cohorts are very different. Furthermore, we would like to establish a method to quantitatively evaluate those patient-derived cell cultures. So by using MATLAB App Inventor, we've developed a customized program, and it contains an interface and uh, and some codes to achieve multiplexed prototyping of those patient-derived cell cultures. Here shows the main interface of our program LIQBP. So it's very straightforward. Users merely need to click the select images button and choose the test images from their computers. The program can automatically process those images by several steps. First, it will identify the regions of interest, which are those microwells, and then to extract some features and characterize the cluster parameters, including cluster size, thickness, roughness, and compactness, and eventually to display those quantitative results automatically on the on our interface. So here shows the principle behind the interface, which based on the label-free image-based algorithmic analysis. So after the regions of interest microwells has been identified, we used the edge detection-based method to detect the clusters within the microwells. After the edges of those clusters has been detected, plus with some morphological or algorithms, including dilation, filling holes, clear board, and can eventually derive the binary image. So based on those binary image, we could calculate the number of the white and black pixels to eventually calculate the size of the cluster size. Furthermore, those binary images could be used as the masks to extract the cluster size within one tested images, and we can further calculate the average grid values and the standard deviation of those grid values to represent the cluster thickness and roughness. Normally, if normally the grid value decreased, meaning the clusters become more denser. So by combining our personalized evaluation biochip and our customized user-friendly program LIQBP, we could provide a prognosis prediction and allows timely medical interventions for cancer patients. The whole workflow is showing here is very straightforward. Firstly, we need to collect the blood from patients and do the red blood cell slices. So only nuclear cells were retained, and those nuclear cells were seeded into our microfluidic biochip for culturing. So within the 14 days, we use a phase contrast microscope to monitor the patient-derived cell culture's morphology, and those images can be detected by our customized LIQBP program. And then we could easily distinguish the healthy and patient cohort significantly by using the cluster parameters. Furthermore, we could do clinical correlations based on those cluster parameters with different treatment stages or cancer staging of the cancer patients. By integrating our biochip and customized program, we could do virus downstream analysis, including the drug efficiency screening in and clinical correlation analysis. So firstly, we verify our methods by using clinical samples from healthy donors and gastric and breast cancer patients. So the results has shown that the patient derived cell cultures from healthy and patient cohorts are rather significant from one another cohort. To verify the cells within the microchannels, we also use the immunofluorescence. And by comparing the parameters derived from healthy and patient cohorts, we found that the cluster derived from cancer patient has significantly higher SD values, meaning those clusters were much significantly rougher than those clusters derived from healthy donors. We also used the area under the curve to evaluate our distinguished performance and derived a high sensitivity and specificity, both above 80%, demonstrating our method could significantly distinguish those two cohorts. Furthermore, e- do we did the clinical correlation analysis by comparing our cluster parameters with different uh, treatment cycles and cancer staging. So the results has demonstrated that the RGVS values, which is the ratio of the gray values to cluster size, correlated positively with the treatment cycles, which means clusters were significantly denser with advanced treatment cycles. On the contrary, the RGVS values is inversely correlated with the T staging, N staging, and overall cancer staging, which demonstrated those clusters with advanced T, N, and overall cancer staging were looser. So based on the cluster morphological changes, we could evaluate patients' response in a label-free format. So our technology is based on the microfluidic biochip and automated LIQBP analytical tool, which could achieve real-time evaluation of the patient response and multiplexed prototyping analysis. Our microfluidic biochip also can achieve high throughput property and rapid detection. It has various applications, including the drug screening test, clinical correlation discoveries, and also it could be further minimized to minimize the optical system to achieve point of care, disease detection, and mobile health as well. Also, our technology has huge commercialized potential because our technology is reliable, rapid, convenient, affordable, and versatile. So that's all my presentation. Thank you all very much for listening. I would like to thank all my colleagues my of of the work and my supervisor, Prof. Ku, for unwhelming support. Special thanks goes to Dr. Mohammed for giving me this opportunity to participate in this wonderful conference. Thank you all very much.